Thank you for joining us today on another installment of Frost & Sullivan's exciting podcast series highlighting key disruptive technologies, growth opportunities, economic trends, new business models, industry convergence, emerging geographies, and much more. We will now be listening to Reenita Das, Partner and Senior Vice President of Transformational Health Division at Frost & Sullivan, talk about how healthcare delivery will transition from hospitals to an anytime, anywhere model in the coming years at the 2019 Dubai Health Forum.
What is the transition of care delivery going to be? So from a provider perspective, we are really looking at moving the model from disjointed care, which is episodic care, that is when you get sick, you see a doctor, you come into the radar, you get well, you leave the radar, to a continuous coordinated care model. We're also looking at a model where rather than having discrete interactions, it's going to be coordinated, and eventually it's going to be location agnostic. As I said, anywhere, anytime. It does not have to be based on a hospital. And really we're going to go into a virtual world where most care is going to be outside a hospital. And I know the earliest panelists talked about future of hospitals, and in our belief, the hospital is eventually going to become an ICU of the future, where they're really going to treat intensive care patients, and everything else is going to be around the community, around your home, and maybe even in retail stores and shopping malls. From a patient perspective, obviously, care is going to be, information is coming from a variety of sources. All this time, information was coming from your doctor to yourself. But now, the patient is much more empowered and there's information coming from very many sources. Second of all, we're looking at medicine moving from generalized medicine, which is one size fits all, to personalized medicine. It's based on my genomic sequencing. It's based on my food habits, how many hours I sleep, what air I breathe. It's based on a lot of social determinants of health, which is personal to me. And the last factor is that obviously healthcare was very reactive. You got sick and then you got a drug to get better. But here we're really talking about products and solutions that will help us be well longer so that we don't have to get sick. So where the dollars will be spent more in the future is in keeping people well, not keeping people sick.
We hope you found this podcast insightful. Check out the space for more exciting updates on the future of health from Frost & Sullivan. To know more about our growth partnership services, email us at digital@frost.com. Thanks again for tuning in.